Hello, I'm Kristen Scott from Sac Fit Wellness, and I'm here today to talk to you about your boots. So we're going to get started with some information about the foot. So we're going to talk about some basic anatomy and movements of the foot to start off with, because understanding why you wear your boots and how they affect the movement of your foot is going to help you learn what you can do to compensate for some of the potentially negative side effects of those boots. So we'll start off here looking at the bones. So the foot is actually incredibly complicated. With your foot and your ankle, we're going to be talking about kind of both of them as one thing today. And the one time I am going to glance at my notes here today is to give you some numbers. We've got 28 bones, 33 joints, 112 ligaments, and this is all controlled by 33 muscles. So there's a lot going on here in the foot. These back bones here are the ankle bones, and you can see just visually that they are designed very differently than the bones of the midfoot and your toes. So they have very different functions. The bones of the heel are large and very much designed to absorb all shock. So that's where your force is supposed to hit. When you heel strike as you walk, it goes right into the ankle. Okay, so these bones are nice and big, sturdy, able to support that. As we move to the midfoot and the toes, this is where you have those fine-tuned adjustments as you walk. So if you walk and you happen to come across a little pebble or something uneven in the road, your smaller bones of your foot are more able to just make slight adjustments and slide alongside each other to make sure you don't fall, that you can actually just adjust your positioning. So very different purposes for different types of bones. The other thing I'll point out here is the fibula and tibia. These are the two bones of your lower leg. These come into a joint with this bigger bone here, which isn't labeled, called the talus or the talus, depending who you ask. And then you've got your lower ankle bone. This is actually the heel bone, the calcaneus. So there are actually two different places where movement happens in the ankle. This higher part here where the tibia and fibula come together with the talus, this is where your ankle does these types of movements. So pointing your toes, flexing your foot back, just a kind of upward, up and down or forward and backward motion only at this higher joint. At this lower joint where the talus and the calcaneus come together, there's a lot less movement, but it is more of the side to side movement. Most of us know this as pronation and supination. So when your ankle turns sort of in and out, that is happening at that lower joint. So most people don't realize there are multiple joints there in the ankle, but it's kind of important to understand that from a perspective of mobility. This is just a few of the muscles and tendons in the foot. So you can see most of the larger muscles are coming down from the leg, and those are involved in the kind of that flexion and extension, or the pointing of your toes and the flexing of your foot movements, crossing that part of the ankle. And then you can see going up through these small bones, those are still controlled by the nervous system. And that's what I was saying is where all the fine-tuned movement happens, when you do need to adjust, make small adjustments so that you don't lose your balance. So that's controlled by some of these smaller muscles that do run all the way down to the toes, because obviously we can all wiggle our toes. So there are muscles going all the way. And again, reminder, everybody's usually very familiar with these. We've got your Achilles tendon in the back, coming around the heel bone, the calcaneus, to the plantar fascia. So what's important to know about this with respect to the ankle and the foot is that really the fascia, most of the fascia in our body is interconnected. And this is true. There's the sheath that runs here with the plantar fascia actually is connected to the Achilles, which actually is connected all the way up the back of your body, all the way to your temples. So if you have something going on here, you could feel it just about anywhere in your back. Okay? So when we have foot problems, it really, as you're going to see, affects everything. So tight plantar fascia can be pulling on, sometimes we see pain here in the forefoot, sometimes pain here in the heel. Same thing with the Achilles. If it's tight, You may feel it from the calf. A tight calf can sometimes cause plantar fascial pain. So lots of interconnectedness with all these things, but these are the two main areas we tend to hear complaints about within the foot. So what we're going to talk about today are some of these dysfunctions, these biomechanical problems that happen due to the boot wearing. So wearing the boots, the idea is good. It's to stabilize the ankle, right? We're trying to prevent ankle injuries from the from your ankles having too much mobility, so that you're more likely to injure yourself when in an unstable situation. However, it does put our bodies into a less natural position, as we'll see in a moment. So it does lead to some biomechanical dysfunction, okay? And I just, this kind of quotation here really just sums it up, which is that your ankle acts as a shock absorber, as I mentioned, those larger bones, to your body. And if you constrain it, it can't absorb the forces. The forces that occur get pushed further up the chain. As I was mentioning, it's all connected. So rather than the ankle absorbing the forces, it goes into the knee, the hip, and the lumbar spine, which is that lower part of your vertebrae. So kind of how if you wear a ski boot, you've had this feeling before. Your boots aren't quite that restrictive, but the idea is the same, is that the forces get sent up the body when we can't absorb them fully in the ankle. So here's what we're going to cover today. First, this ricochet effect just refers to how when you have postural changes due to the boots, it sends a change in the forces and in your posture all the way up the whole entire body. We have a problem with locking and unlocking of the midfoot, which relates to that plantar fascia pain that people tend to get. The posterior muscle engagement and sequencing, this is due to the fact that most boots have even a slight heel, can have an impact on muscle engagement. And then last, a couple of concerns related to the basic fit of the boots. So this can be related to foot or toe health if your boots don't fit your foot properly. So we're going to talk about each one of those now, starting with the ricochet effect. So this top image here shows you kind of the problem places that tend to pop up when we wear a restrictive shoe, okay? So this is the proper alignment of the body. With the shoe, with the boot and a slight heel, not only does it adjust the positioning of the ankle, it can actually lock your, if you're normally, let's say, perfectly here, let's just say this is perfectly 90 degrees, the boot may lock you into some other slightly different angle at the ankle, especially if your boot has a heel. Okay, so there's a lot going on there where it's going to shift your center of mass. So your body's center of mass, if let's say if you, while you're watching this, stand up and shift your body weight forward, you immediately feel your foot has to completely engage, and your pelvis will start to pull your upper body back to compensate. So if you're shifting forward because the angle at your ankle changes, your body will compensate all the way up the chain, and that will throw your posture off of what's meant to be your natural posture. So typically the places that this causes an issue are shown here. It can be your calves, can be your hips, your low back, or even your upper back. So a lot of times people don't realize that their upper back pain could be coming from something that's happening at the ankle, but it's possible. So we have the center of mass shifted forward, compensation that alters your posture, and like I said, this can definitely lead to lower back pain as you shift that upper body back and put an unnatural arch there in the lumbar spine. It can also cause fatigue because now your body is actively supporting your posture in an unnatural position for it. So it's working harder. And then it can actually also cause you to feel unstable on your feet, especially as you fatigue. As those muscles that aren't used to being so active wear out, you actually are more likely to lose balance and not be able to maintain a safe posture. And we started to talk earlier about plantar fasciitis and some of the things that can occur with that. So the plantar fascia, this is that fascial piece that runs across the bottom of your foot. It is designed for shock absorption, okay? So much of the foot, like we talked about, as you're walking, is absorbing shock. The main brute force of it is in your ankle, but then as you walk and roll to the forefoot, that plantar fascia is also helping because it can adjust in length a bit, it can stretch. It's also helping to absorb shock, and it also is providing support for the arch in your foot. So once we have any type of injury or overuse or scar tissue or any type of a situation with the plantar fascia where it is pulling either here or here, we're going to see pain, inflammation, and potentially even heel spurs at the heel attachment. So this is the type of thing where people tend to not so much worry about the foot. Plantar fascia, I'm good, I'm gonna push through it. The thing is, you push through these things, and instead of being a 1 or 2 day rest period that you need to take for it to recover, it becomes surgery. So my suggestion, strong recommendation, is that if you are having foot or ankle issues or pain, is that you don't wait to get them checked out, because really without your feet functioning properly, you really can't do much, and you certainly can't do your job. So important to pay attention to cues that you're getting from your feet, especially along the bottom of the foot. If you start to have any type of pain there, get it checked out. It may be something as simple as an insert for your boot that will take care of it for you. So clearly, your boots are not 3-inch heels typically, or 5-inch heels, whatever these are, but it's a little easier to see the effect of a heel when it's this exaggerated. So your heel of your foot is structured, as I mentioned, to absorb that blunt force. The midfoot is structured for directional change and balance, as we talked about. So when you elevate the heel of your shoe, this causes some of that blunt force to be transferred to the midfoot. The midfoot is not designed to handle it, okay? So wearing heels for any extended period of time is not recommended and is unnatural for your foot. It's not the correct position for your foot, and it's not the correct situation for walking, really. Now, obviously, your boots are going to have a much lower heel than this. But what you can see here is even just this slight shift does move some of that blunt force to the forefoot, to the midfoot, again, where it is not designed to handle it. So let's look at just the difference between a 1-inch heel and a 2-inch heel. So a 1-inch heel, which is very small, does increase your forefoot pressure by 22%, and a 2-inch heel as much as 57%. So while you may not think your 1-inch heel is a big deal, it actually does change that dynamic in the foot enough that it's almost a 25% increase in the force into the forefoot. So definitely can be problematic. And so the goal here would be to keep your heel as low as possible in your boots. And if it is higher, more reason to wear them for a short period of time as possible. I also mentioned at the beginning that the heel can cause different types of muscle recruitment. So on the left here, we have the activation in the erector spinae muscles, and these are the muscles of the low back that help hold your posture erect. So they're always active. They're very, I kind of call them low voltage muscles. They're always active, but they don't generate a lot of force. They're just kind of always there helping hold your posture. So when you increase heel height, you increase activation of those muscles. So if you've ever stood for a long period of time in any type of heel, over time, you do start to feel that in your lower back because those muscles are working a lot harder than they are used to and really designed for. Moving to the right here, this is the gluteus maximus. So you can see here, it's the opposite. as you go up in heel height, we have less activation. Gluteus maximus is one of the larger, but also one of the most powerful muscles in the body, the largest muscle in your glutes. And we really need it to be firing. It helps a lot more than the erector spinae with overcoming fatigue in being standing upright. So if you take the glute max out of the equation and you add in more erector spinae, what you're looking for is low back pain for sure. Okay, you're throwing off your what your muscles are designed to do, and so it changes the muscle coordination patterns, the recruitment in a less than ideal way, which again is over time going to lead to misalignments in the body and compensation in areas that are going to be causing pain as opposed to what they're designed to do. And then, of course, we want to make sure the boots fit properly, which again, this is something that a lot of people will just overlook at first. They'll think they're new, they're supposed to be a little uncomfortable, or I've had them for a while, I probably need to get new ones, but I don't want to deal with it. Deal with it. These are your feet, and you don't want really any of these things to start happening. We can have nerve-related problems where something is pinched or inflamed, which means ongoing pain, or even a lack of proper function if the nerve signals can't get through. We can have any type of these bone deformities, which is like an outgrowth, either from the boot in the back being too tight against the heel bone, or sometimes even too loose and rubbing improperly. We can have hammer toe situations, blisters, corns, and calluses. A lot of us are familiar with the blisters, corns, and calluses, but if you start having those, that's a sign that you probably want to do some proper fitting to make sure you don't move into any of these other areas. And I would just suggest, if possible, seeing a podiatrist. And it may be, like I said, as simple as one little insert that makes the boot fit that much more, fit that much better for your foot, that will prevent a lot of these issues and some of the other ones we've been talking about as well. So use these kind of minor pains, if you will, as a signal to get the fit figured out sooner than later, so that you don't run into the bigger problems down the line. So now I've given you all the doom and gloom, all the bad news about boots. You probably think, well, maybe I should just, wear my tennis shoes. No, the boots have a purpose, and they do work in helping to prevent ankle injuries. But there are some things that you can do to help compensate for or eradicate some of these other issues that might occur from wearing boots. So let's talk about what you can do. Strength, flexibility, control. With control, we're really going to be talking about stability. So I'm going to show you some exercises in each of these areas that you can do throughout your day or during your workout to really help strengthen all of those parts of the foot and ankle joints so that you can prevent potential injuries and strengthen those areas to allow for proper posture. First thing I do need to show you, though, is going back to the movements of the foot. Give you a little bit more of a visual of those so you can understand why the movements I'm going to show you, the exercises, will help. So we talked about this movement of the higher joint of the ankle that allows you to point and flex. So this is called dorsiflexion, is where you bring your toes up toward your lower leg. And typically the average here is about the ability to do that about 20 degrees. And then plantar flexion is pointing your foot, and typically that can be up to about 50 degrees. So you have a range of motion about 70 degrees. A good thing to do here is test this on yourself without your shoes on, and then try it again with your boots on. And you'll see how much the boots really limit even this up and down range of motion, which is what they're supposed to do, but it will give you an idea of why it's important to compensate for that when you're not wearing the boots. So 70 degrees possible here when you are barefoot. And this is the other movement I was talking about, which is at that lower ankle joint. Neutral, and then inversion and eversion, which kind of looks like supination and pronation. Like I said, it combines a couple of different things, but this is generally the idea, if you think of supination and pronation of the hand, same thing of the foot, just not as big of a range of motion, but important for maintaining balance to be able to shift from the inside to the outside of your foot. So let's talk about strengthening exercises for pronation and supination first. And you may not think of the squat as an ankle exercise, but what I want you to encourage you to think about is what is happening at the ankle when you squat. In fact, as you're watching this, stand up and go into a squat and just pay attention to what's happening at the ankle. What's the angle at your ankle, which is really hard to say, and I've said it a bunch of times. I'm very proud of myself. And again, you can't totally see it with a looser pant, but as you come down into a squat, what happens is the knee moves forward, which means that I'm not necessarily moving my toe in dorsiflexion intentionally, but that's what's happening, is as I bend my knee, my toe is getting closer to my shin, which means my ankle is in dorsiflexion. So doing the squat actually does move your upper ankle joint through dorsiflexion and plantar flexion as you go in and out of the squat. Okay, so it's not necessarily the purpose of the exercise, but doing squats really will help strengthen that movement and that ankle joint and the muscles supporting it. The other thing that's important as a strengthening exercise would be a deadlift. And this is because of that whole posterior chain, which I don't know if I've used those words before, but that's what I'm talking about when I'm saying how everything's connected all the way up the back of your body. The fascia even helps, basically the fascia is kind of like webbing around your muscles. So the fascia is interconnected, which technically means that all of the muscles work interconnectedly as well. So we call that the whole posterior chain, the muscles that run up the backside of the body. So the deadlift really does work that whole entire posterior chain and is important for when we were talking about activating the gluteus maximus. That's really what the main thing you're going to get with that deadlift, if you've done properly, is going to help strengthen the gluteus maximus and encourage it to activate properly. So the key with the deadlift is mostly form. So as you can see in the don't do this picture, we don't want your back rounded. So you're only going to come down as far as you can. If you start to have to do this to go lower, stop. So it may be that you can come to here. It may be that you can come to here. But the idea is that your back isn't moving. It's just your hips. Okay? And as you come up, you contract through the glutes, activate that whole posterior chain. So a really good strengthening exercise that most people are already doing without really realizing the benefits, for posture. Now we're going to look at some strengthening exercises for that eversion, inversion, and then another one for flexion. So most of us don't do enough lateral motion. Getting in and out of your truck or your engine, rig, whatever, you are doing some, but for the most of the rest of the day, our movements are forward and backward. Sitting, standing, even squatting and deadlifting that I just showed you, they're all in the same plane of motion. So it's really important in your workout to incorporate the movements that are in this other planes of motion. So moving side to side. So you can do this as a stepping exercise where you come out and you can see what's happening at my ankle is trying to keep my foot flat on the floor, but I'm doing eversion and inversion. Okay? So you can come and step back, you can do it in holding it position and shift side to side. So lots of different ways you can do this, but the idea is just to make sure you're doing some sort of side to side movement and that you do both sides. Okay? So getting that movement at the ankle this way, and you're also that way activating some of the side muscles of the glutes that tend to also have issues with firing and can cause lots of issues throughout the body. The other exercise shown here is more of a moving back to that upper ankle joint. And for this one, if you have a loop that you can put around a stationary object, I wouldn't recommend a chair if it's something that's not going to move, and put it around the forefoot, pull that forefoot back towards you, again in that dorsiflexion movement. This will help strengthen the front of the leg, which again, most people don't tend to focus on, but this is our shin splint area. So when you have your boots on and you're locked in your ankle mobility, shin splints are actually something that could start to happen depending how the boots pitch your body at the ankle, what the angle is. So moving into flexibility exercises, a tennis ball is a great tool. You can use obviously other types of implements as well for rolling out the bottom of the foot. If you do have that tight plantar fascia, anything that you can kind of roll under your foot will help. Tennis ball is really good because it has some give to it. A lot of people like to use a lacrosse ball. Lacrosse balls have less give, so you can progress to that. Some people are crazy and use a golf ball. So that is way down the line if you have the really healthy feet already, but I would start with a tennis ball. And again, if you have one spot that's really tight and sore, as you kind of work your way through your foot, pause and hold and just rest your foot on that tennis ball. This is something you can do while you're watching TV or on your computer. Just roll something around on the bottom of your feet while you're barefoot. Here, other great tool you have is your hands, right? So pulling back on the toes to really kind of stretch out the front of the foot, massage or pushing your thumb into the back of that arch in the heel area. You really can manipulate your own foot and find the ways that it feels good. There's not necessarily one right way to do this. Everybody's foot structure is going to be personal, and so you may have different aches and pains than someone else. Find those and try to work through them. You can also use like a Theragun, that type of a thing. There's so many now. If you go and search for foot massage tool, there are millions, but tennis ball is really a great, very easy and inexpensive option. And then the other thing I highly recommend is just moving around. Barefoot, doing lots of movements through your feet. Going up on your toes and back down. Going to the outsides of your feet and the insides. Just really moving that ankle joint as much as you possibly can. Obviously while you're not wearing your boots, and ideally while you're barefoot. Really get that foot moving through its full possible range of motion. It's very mobile as a joint when it's not in a shoe. So putting it through its paces and allowing it to have those movements as much as possible. So you can do this type of thing multiple times a day. It's not gonna make you sore or anything like that. So I would just really recommend trying to move those feet as much as possible all the time. We also need to touch on that posterior chain in general for flexibility. So starting at the hamstring, most people have very tight hamstrings, almost all of us. So most of us know some of the typical toe touches, pull your toe back and bend over slightly here. You should feel the pull through the hamstring. But if you want to do something slightly more passive and more directed, you can simply place a tennis ball under the hamstring, kind of roll till you find a sore spot, and then just relax right onto that spot on the ball. You do want to keep yourself upright, keep the posture through the back without any rounding. And there's no set amount of time, but what you should start to feel is a release. So it may take 30 seconds to a minute, it may take a couple of minutes. But the key thing to be doing while you're sitting here is breathing. Make sure that you're breathing. And what I'm doing without even thinking about it is I'm contracting my quads, so I need to relax. So you're going to constantly be breathing and telling yourself to relax. Okay? So we all have our things where we don't really relax. So that's one thing you can do. You can also use a foam roller for the same kind of thing. If I had a foam roller here, just would find the spot and then relax onto it and stay there and breathe and relax. Okay. If your hamstrings are tight, typically you're also going to have tight hip flexors. And a lot of people don't really pay attention to these or stretch them. So the hip flexors, what's interesting about them is, you might say, Kristen, that's in the front. That's not posterior chain. However, the hip flexors at the top actually attach to your lumbar vertebrae toward the back. So they attach to the lower spine in the back. So if your hip flexors are tight, which means your hips are kind of pushing forward or shortening this way, and it's pulling, where are you going to feel it? Low back. So when someone has low back pain, I typically go to hip flexors and then hamstrings. It's all interconnected. So hamstrings, important to work on. Most of us know that. Hip flexors, not so much. A lot of us do this quad stretch. Great, stretches the quads. However, why not do double duty and stretch your quads and your hip flexors at the same time? So most of us, again, know a hip flexor stretch, like the woman in the first picture is doing, kind of a runner's lunge, or you can have the back knee down, as I do, or she does, and push forward into it. That's a great hip flexor stretch. If you want to try to stretch both the hip flexor and the quad at the same time as the guy in the last picture, you will have to come up a little bit higher so that you're stable, and ideally put something under that back knee. But as you pull up here, now I'm feeling that stretch through the quad all the way up into the hip flexor. And you can start to push forward a little bit once you're in the position. So great way to save some time, because we all know most of us aren't doing a lot of stretching. So why not do two things at once? It's really going to help open up the front and the back of the body. I do recommend putting something under your knee. The other place down the back side of the body that we do need to stretch out is the calves, the Achilles tendon, and then even the arch of your foot. So remember, this is all connected. So calf stretch, a wall is great, but you don't necessarily need one. So just pushing your heel down in the back makes this a calf stretch. Okay. Ideally, it's nice to have something you can push up against and lean into then to stretch lower into that Achilles tendon. So curbs are great for calf and Achilles tendon stretching. And then the arch stretch shown here, it's kind of similar, like the opposite of the tibial strengthening, where this is really up to you and your flexibility. Shown there is using a towel. If you have the flexibility, you can also just use your hand. You could use resistance loop, whatever tool you have on hand. And again, it just should be to where any of these stretches should be to be where you feel comfortably uncomfortable. We never stretch to pain. We stretch to uncomfortable but not pain. Hold it, breathe, and then try to go a little deeper. But you can see in this picture too, this does lift the heel off the floor, which means that there's also going to be some stretching happening up that Achilles tendon with this stretch as well. So again, double duty, probably into the calf a little bit also. And this, here's one that most people have never done. And I started doing this type of stretching when I had a very brief time in my life where I decided I was going to run a half marathon. And I trained and I was doing really well until one day I made a mistake during my training run and ended up with shin splints. And once you have shin splints, you have shin splints, and it takes a long time to get rid of them. So I started from that point stretching my tibialis anterior, which is the small muscle that just runs here along the front of the lower leg. It can be something as simple as, again, if you have the flexibility, doing what I'm doing right now and pushing on your toe. A lot of people aren't going to have that flexibility. So what you can do instead is just go as far on. It's easier to do barefoot in a shoe with a more rigid, I guess, toe box. You're not going to be able to do it as well. But you're going to push your toe down. You can see the guy has his toes bent, almost curled under. I can't do that in my shoe. But feeling the stretch up the front of the leg. You can also use a foam roller, as shown in that second picture, or even coming across and going sideways allows you to get kind of a deeper, different angle. Again, recommend doing this barefoot or with socks at most so that you can really get into it and be able to bend those toes. And actually, this is another great stretch, even for the toes, because we very rarely stretch out our toes in that direction. We kind of tend to pull them back more, but pushing them forward should just be another part of your routine as you're moving your feet through that full range of motion, ideally several times a day. And then moving back up to the hips. So we talked about the hip flexors and the quads, but now let's talk about the glutes and the back of the hips. So a couple things here. You can do piriformis stretches, which a lot of us think of as the figure 4 stretches. You can do it seated. Bring one foot over the other. And again, trying to keep your back straight, lean forward. You should feel this on this side in your glute. You can also do it on the floor. Bring one foot over the other ankle, or one ankle over the other knee. And how far you come up will kind of depend on your flexibility. You may only need to come to here. I need to come to here to really feel that in this glute and get a good stretch. Lots of different ways you can stretch that muscle, but this is a good one and pretty easy to do anywhere. The other thing here is the 90-90 hip sequence. So this one, you have your forward and back legs both at 90 degrees. And I'm going to shift because that's not going to work right when I try to go into it. And you're going to move through some ranges of motion with your knees in this position. You can start to come forward here. You can come back here. And if you Google 90-90 hip sequence, there will be lots of videos showing you this. This one, what you're trying to do is come so that you're squared over this back leg. A little bit more challenging of a position to get into. But the thing that I really like to recommend to everyone, but especially people who do have issues with hip mobility, is, and I should point out that just getting into this position may not be something that works for you. You may not be able to get your knees down, okay? That would be very normal. So starting here and simply just moving through this movement is a great place to start. It doesn't look like much, but what you're doing is when you think about that foot movement of eversion, inversion, at the hip, it's internal and external rotation. So I'm doing internal and external rotation of both hips at the same time. So again, I like to save time when I'm working on my flexibility and mobility. So this is a great way to do that. As you are able to get your knees down to the floor, absolutely do that, but you can work up to that. You may start here, which is just fine. Okay, but that's a really good way to really encourage mobility. What I'm basically doing is this, at both hips at the same time. So it's a little coordination too, which is always a good thing. So there were a couple strengthening things, a lot of flexibility activities, and now we're going to spend a minute talking about stability. So stability, you can see these two pictures here. What they have in common is that there are 2 points of contact with some other surface. I would say the ground, but they're not on the ground here. But there are 2 points of contact and a very wide base of support between those 2 points of contact. So this would obviously be kind of level 1. And this would be a progression. And then you'd move to possibly here and then possibly here. So what we're looking at here is you could actually start, I should say level 1 is standing in a neutral position, closing your eyes. And you'd be amazed how much you'll start to feel your feet adjusting. Because once you take away the visual, your feet actually have to kind of guess what's happening and they start being very active. Then move to standing on one foot, first with your eyes open, then with your eyes closed. And just closing my eyes, you can see it's insane, right? So if you add a thick padded floor mat and do that same thing, that's going to take you to the next level of stability. And again, having that back foot still on the ground, this is the foot that's going to be kind of adjusting to that pad that's less stable. So you'll be working on the mobility of the front foot. And again, you're just sort of training your nervous system to be more efficient at responding to uneven surfaces. So initially, you may also want to have something nearby that you can hold on to. Okay? Then with the Bosu ball, obviously adds another layer of difficulty. Even with that one foot on the ground behind you, it's a less stable surface. Then these other two pictures, you'll notice now there's not that other foot on the ground. So moving your foot in front of you, behind you, out to the side, all of those will test the stability of your ankle that is on either the pad or the Bosu ball. So it is a good idea to, as you can see this picture, he's got his foot in front. The other picture, the foot's in back. Both are good to do. The next thing that you can progress to once you've kind of got these figured out is doing your weight training while standing on a Bosu ball. So again, ultimately, don't start there, but ultimately that's a great way to train your strength and your stability at the same time, because really when you think about functional strength, functional wellness, a lot of times you guys are carrying and moving heavy things as you are being mobile. So being able to do your weight training while standing on one foot on a Bosu ball means you are much less likely to have an injury on a call. Okay? So here's some old, well-worn boots. And just kind of showing you the difference of, obviously, when you shift out of your boots, what you shift into does also matter. I strongly am a supporter of going barefoot at least part of your day. I know that's not always ideal or possible, but even if it's just for a brief amount of time, say after your shower, where you do put your feet through those full ranges of motion, highly recommend. Going from boots to flip-flops is probably the worst idea of all these, just because you're taking rigid support to kind of the, I would say it's more the opposite with flip-flops than it is even with being barefoot. Because with flip-flops, there is still some activation of foot muscles that isn't happening with the barefoot. So I'd rather see you go to barefoot than flip-flops. I love flip-flops, don't get me wrong, but they're one of the worst choices we can make for our feet. And then depending on what other activities you're doing, having the right amount of support balanced with flexibility is critical. And just really be thinking about those transitions, okay? The transition from boots to other shoes to barefoot, etc. Those are the best times to do those full range of motion activities to kind of wake your feet up. If they've been in the boots for a long period of time, really do some of those flexibility, even just moving your foot around in all possible directions before you shift to another shoe or sit down, lie down, whatever it is you're going to do. So a couple of other things you can do, kind of some tips beyond the exercises. First tip is to take your boots off whenever you can. Okay, if you don't need to have them on, take them off. In fact, generally speaking, avoid staying in any one type of shoe for extended periods of time. You saw I'm wearing really great supportive cushioning shoes, but it doesn't allow me a full range of motion in all the ways that I was trying to show you today. So any type of shoe for extended periods of time can throw your body out of alignment. New boots, pay attention to make sure they fit properly. You don't want friction or pressure. You don't want them to be too big. You want them to be just right. And if you need some inserts, work on getting those. And which is what this is. Sometimes it might be an arch support, might be a heel cup. Sometimes they put a pad in the front so that you're not sliding. Lots of options. If you do have issues from the boots, how can you help heal those things? A lot of things we've talked about. Stretch and move the foot and lower legs before each transition, meaning in or out of your boots. Briefly massage or soak your feet at the day's end if possible, or whenever you have a chance. If your feet do get swollen, you can ice them. Sometimes that can feel really good. And then if you do start to have any of these things at all with any frequency, see a doctor. A lot of these foot problems, as I mentioned before, will get much harder to treat as time goes by. So it's better to take one day off now than 3 months off in the future. And general habits when you're wearing your boots, still try to focus on an upright posture. So a lot of times, because the boots do tend to pitch people forward in the lower body, and like I said, you shift backwards in the upper body, just try to focus on really keeping your chest up and your core activated. And the thing I'll mention about the core, most people don't realize, is that your glutes are part of your core. So when I say activate your core, most people suck in their gut, which is not what I want you to do. Okay, so it should be a tightening and a kind of neutralizing, if you will. So by contracting the abs as well as the glutes, it really kind of creates this nice, solid, good pressure throughout that whole region to stabilize it and help prevent low back pain. Okay, so consider your glutes part of your core. Keep your chest up, forward, and contract the core and the glutes to stabilize. Stretch and release when transitioning between footwear. I've said that now 18 times. It must be important. And avoid equally rigid shoes in your off time. Okay, so that should go without saying. If you can avoid wearing boots in your off time, do so. If you have something else where you do need to wear boots, follow the same guidelines and really try to minimize the amount of time in your boots as much as you possibly can. And get a lot of movement in when you're not wearing them. And that's all I have for you today. So if you do have any questions, feel free to reach out to your training team. They can put you in touch with us and we can answer your questions. If you need additional support, help, anything like that, please reach out. That's what we're here for, and we'd love to help you out. Thank you.